The acute care bundles approach was very helpful in a way that it gives you an instantaneous information about patients' care. Patients, after they land within hours, their data is recorded into the spreadsheets, and data is collected, and the team can see within a week how they performed within that week. This helps us with regard to the memory of patients' care as well, because we all remember our patients. We all know within a week how we cared for them, what was the problems with the process itself, which give more insight into patients' care and more insight in refining the process and making it better.
The bundles themselves, as the documentation, is very visible on the ward for staff to use and complete, and it's being done regularly by different members of the team, which I think is something quite nice. It's not down to one person, it's a team approach, more than one person filling in different aspects. A team approach that's encouraging setting MDT goals, so the patient is at the centre of that care.
The metrics of the acute care bundles are helping us to shape the process of care we provide. For instance, we are aware of difficulties we have or some reasonable delay in terms of the process of care, that patients come into the emergency department and go to the assessment unit and go to the stroke units. And from looking at the data, this could be better addressed if patients came directly to the acute stroke units. And we're working with the acute stroke teams to try to aspire and achieve that. If we are being very diktat about achieving 90% of deaths or 80% of that, we'll find the focus and emphasis will be shifted on people achieving the figures rather than looking at the process and improving the process of care. Whilst if we leave the data for the clinicians meaningfully to interpret and marry that with looking at the process of care, I think that approach will be very successful in improving care and quality of care for the patient. The response from the executive board and from the clinical program group board was very supportive. They have left the ownership to the clinicians to improve performance. And once the results came back as it is, there's a great improvement in patients' care and a great improvement in the data itself. There was a lot of positive feedback to the staff. There was a lot of more cohesion between the team on the ground and the executive team or the board of directors.
I think the service for the patient is efficient and streamlined. There is a set pathway that they should follow, and it gives a seamless transition through from admission onto the next phase from acute. This
has been reflected very clearly into the compliments we received from patients and families alike about the process of care we provide here in the stroke units.